Hello and welcome to the Spinal Podcast. My name is Dr. Brian Joves.
And I'm Dr. Jason Kung.
And thank you guys again for joining us. Thank you, Dr. Kung, for being here with me and for kind of pushing on into the realm of podcasting. You guys have really kind of stuck with our podcast as we've kind of transitioned over the past year. You know, we had Dr. Carvelis, who had helped us for a long time, but ended up moving out of state and has gotten busy with some other things. And yet somehow our podcast persists. One of the fun things we're at the very beginning of 2024, and at the end of every year, Spotify does this thing that they call Wrapped for Podcasters, where they actually give you a lot of feedback about, who listened to the podcast and how many people listened. And I always think it's really fun to kind of look at. And I've never actually showed this stuff to Dr. Kung. And so I think some of the things that we're going to talk about are kind of interesting. Dr. Kung, would you guess that 1/3 of our audience comes from outside of the United States? True or false?
I'm going to go ahead and say false.
Do you think it's more or less?
I would say that it's more on the 25%.
Okay. A full 1/3 of our audience comes from outside of the United States,
That's
with
incredible.
New Zealand
What?
being the number one location.
Interesting.
So New
Okay.
Zealand, India, Spain, Brazil, and Hungary are where we've gotten the most new international listeners from, which I think is kind of crazy. I do not know uh, anybody that practices in any of those countries, and so I
Yeah.
think it's very cool.
Well, I think it's bon dia to all my Brazilian friends out there.
Maybe,
Um,
maybe we
oh,
need you
really?
to be able to record a. I know that you're multilingual. I am not, and so
Yeah.
you have to bring the international flair to the podcast.
I'll, I'll do my best. I'm still in the middle of using Google Translate during some of my conversations to fill in some medical terms. But yeah, in time, 2024 resolution.
There it is. I like it. So our most listened to podcast was an episode on spinal stenosis, which I think makes sense. I think it's something that a lot of people need to know, want to learn about. It's a very general topic, but it has been streamed like 10,000 times, which kind of blows my mind in terms of just the sheer volume of people that have listened to us talk about spinal stenosis. But it does not, I think that's not very surprising that something that's nice and simple, kind of the bread and butter of our specialty,
Yeah.
was the thing that has drawn the most people in.
Yeah, it's and you know, in practice you see it day in, day out. And thankfully we have some tools to help people manage this, along with our physical therapists, chiropractors, just multimodal. But spinal stenosis is very, 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 very common and tough to treat when
Yeah.
it comes down to it.
Yeah, no, and I mean, obviously, we've done multiple episodes on it, and many of the tools that we have to be able to treat it. But I think it's a pretty interesting thing. That was an episode that was done, gosh, probably at this point 3 or 4 years ago, and still continues to be the number one listened to podcast and the most common way for people to find out about our podcast and then therefore get into other
Hmm.
episodes. Um, but so I know you listen to podcasts, and so I think most of the podcasts that you listen to are may or may not be within the pain medicine or the medicine in general genre. But as you think about like your top 10 podcasts that you listen to, um, well, hey, what would you think is the number one podcast you listen to?
This year has been, I think, pretty much, we drive to work, drive home. So I have about 20, 30 minutes in the morning and afternoon to get my podcast on. And my top one this year is something called the All In podcast. Shout out
Mm,
to JCal and those guys. It's been a great way for me to just kind of stay on top of it, stay on top of just what's going on in the world. And I feel like they have a good um, balanced viewpoint on multiple kind of political topics, financial topics, business topics. So that's probably my top one. And then second is not a podcast, but definitely sports radio, especially this year with the 49ers.
yeah, yeah, a
I'm not
lot,
going
a
to say
lot,
any
lot
more. I'm
of
not going to say any more of that. I'm not going to say any more of that. And then probably the third one is going to be the New York Times Daily podcast, which is a quick, like 20, 30 minute overview of a topic that's going on in the news. And I find that just a quick way for me to really get into, a little more nuanced detail about what's going on in the world.
Right
What about
on.
you?
I mostly listen to kind of like business or leadership stuff.
Hmm.
So probably the one that I'm most consistent with, I think I listen to every episode that he puts out. Ryan Hawk does one called the Learning Leader.
Mm.
It's definitely one of my favorites. And then there's one that I've started fairly new. I think it's mostly started this year, but a guy named Howard Linzon, who I've read his blog for probably 15 years at this point. He's a angel investor kind of guy. Was early into a lot of the kind of newer tech things. He started a podcast called Trends with Friends, where they kind of talk about stock markets and just markets in general. And so I always find stuff like that pretty interesting, and so I think that makes it a little bit more I don't know, well rounded in terms of the knowledge base, since so much other time is spent on all of this medicine stuff.
Yeah, I basically stopped watching the news or listening to the news almost altogether.
Yeah,
Most of the time, uh, Google News just for quick hits, but really like watching or listening to the mainstream news sources is not as common for me nowadays.
yeah, yeah. I think that's a fairly common thing that people
Yeah,
have been experiencing, and so I think that just kind of goes along uh to say more of the reason why we're so excited that people listen to the podcast and to our podcast. We were in the top 10 of people's podcasts for about 750 people, um which I think is pretty cool, because that means it's not just something that people share one or two episodes with. That means that it's something that people do come back to and listen to. And so hopefully people continue to find a lot of value in the things we're doing. Obviously, this is going to be a little bit different than a lot of the podcasts we've done before. Right now, we're just kind of recapping and rehashing some of the things that have happened over the past year, and some of the things we're looking forward to as we prepare to get you more into some of the nitty gritty science that we'll definitely get back to. But Dr. Kung, one of the things that I actually thought was pretty awesome about the way that 2023 wrapped up, is that we actually did a Spartan race together. Yeah.
yeah, I remember, and I remember it vividly.
And so you, myself, and two of the other doctors in our practice, I had this kind of crazy idea after turning 40. I started texting you guys all and saying that I wanted to do something. It started with, I actually tried to convince you guys to run the California International Marathon, and everybody
Yeah, yeah, I quickly vetoed that one. That was me.
Yeah, yeah. I think there's a very strong contingency of people that agreed that running 26 miles was not anything that any of you wanted to do. But we found that there was a Spartan race that was close by just a week after, and thankfully, I got three of you guys to be able to do it with me, which was, I think, it was a pretty fun thing. One of the things that I will say, when I turned 40 and I thought of this idea, I was actually working out really well on top of everything. Shortly after that point, kind of fell off for through fall. I definitely like apple pie and a lot of the treats that come with fall, and I think I fell off a little bit more. And at 40 years old, that fall becomes a lot harder to rectify than before
Uh,
40. So one of the things you have to look forward to.
I'm ready.
But
Yeah,
so
the Spartan race was, yeah,
what did you think? Yeah, I mean, it was a different experience for you, right?
yeah. Running is definitely way low on my skill set. Uh, yeah, I like to think that I thought the obstacles would be, my forte, and I'll be able to cruise through those, and the running is going to be what took me out. It turns out it was actually basically the opposite. I mean, uh, I've never been in the military, but I've heard from a lot of folks that it is very reminiscent of some of the boot camp obstacles. Um, the mud, the cold, the water, and just the length of it. It was tough for me. It was tough, especially some of those uh, long bear crawls underneath barbed wire.
Mhm.
Uh, which I naively thought, there wasn't going to be any barbed wire because that would be too dangerous. Yeah, it was actually barbed wire. They had a great disclaimer and everything, so
Yeah,
we
I
knew what we
think
were getting into.
yeah, I think Dr. Grive was the first to spot that there was in large letters it said "You may die," and he thought that that was a very funny way to start our morning.
I thought about that a few times when I was climbing over something, 20 feet in the air. I'm like, oh yeah, that is very fitting.
Yeah. Yeah,
Um,
it was more so I think the climbing over something with completely wet clothing and wet shoes or muddy shoes. And so, you're trying to, get footing and make sure that you're not falling and with muddy shoes on. So
right.
that part was, as I say, a little terrifying at times.
Did you throw your shoes away or did you wash them?
I washed them.
So did I.
I thought I was going to throw them away, but the frugality inside of me didn't allow it.
Well, now I know that I've done it and I'm probably never going to do it again. But
You
every
know,
time I put on those shoes,
you don't think you
I'll be
you don't think you would
reminded.
do another one?
I honestly don't think so. I think it's great. And for a lot of folks, it's something people look forward to every year. And, but for me, I'm trying to basically just pick and choose what I'm willing to put my body through. I'm big into snowboarding. I know it's also can be dangerous at times, and I think I've internally told myself that if I'm going to go out there, put my body on the line, I'm just going to do it on the mountain.
Right on. I think that's a very reasonable choice. I think that's definitely one of the things that comes into my head more often than not these days. Is this worth the risk? Is it worth if I fall and break a wrist or two wrists and can't work for a while, or
Right.
obviously or something much worse than that. Yeah, I think that comes in, which is why I now hire people to put up Christmas lights. Uh,
Oof.
um, but so okay, so 2023 was a year that was, I think, a pretty interesting year in the pain medicine world. I mean, I think from procedural standpoint, there's now more widespread use of some of the more minimally invasive tools. And I know that you've talked about basivertebral nerve ablation, and that's something that I think really made its way into the common lexicon for a lot of providers, not just in our specialty, but throughout medicine last year. And so I know you've done quite a bit. I mean, how have you felt with that? As it's we come out of that year of your first year of really that being a big component of treating patients.
Yeah, it's been a great year for basivertebral nerve ablation and Intercept in general. I think that from reading the studies and looking at their success rates, everyone was very positive and optimistic about it. But everyone that's doing this should go into anything relatively new with some cautious optimism.
Mhm.
So that's how I kind of uh, thought about it in the beginning, and then as the year progressed, more and more cases, seeing outcomes now 2 months, 3 months, 6 months, a year. It's been quite impressive to see the success rate. It doesn't help every single person, but for a lot of folks that really had no other options, meaning if you're young and you only have this isolated disc degeneration, motor change, really no other ridiculous symptoms, no instability. Most surgeons wouldn't offer surgery, so a lot of these patients in the past would just kind of be in our practice, and we would try other injections or medications. And now that we have this tool, I've definitely seen some patients have just incredible turnarounds. The procedure is it's minimally invasive, so we're using X-ray for the majority of seeing where everything is to do it safely. And now there's generation 3 tools out, which are improved compared to the previous generation. So the procedure itself is becoming more streamlined. The company is super on top of listening to feedback, and I think they're even working on the next generation. So
Nice.
I think it's just going to get better and better.
Wow, that's awesome. I mean, it's definitely been cool to see, a lot of our patients, within the practice that have done well. And, like I said, I mean, I think it's definitely made a big impact in the overall
Mhm.
community of medicine. Because I know from, just, obviously we know about it, but talking to a lot of the primary care doctors, some of a bunch of the surgeons, I mean, it is definitely something that has made an effect much beyond just the world of pain medicine, and something that a
Mhm.
lot of people are paying attention to. And so I think that's pretty cool when you think about it. And it's had it definitely, you said it's had a big year. I mean, I agree. I mean, it really has had a big year.
And for the company itself, many insurance companies now are flat out saying that this is a covered procedure, and the authorization process to get it approved is, that translates into being cut down significantly.
Mhm.
So patients don't have to be waiting around for 3 months, not knowing if this procedure is going to get approved or not.
Yeah.
And then now with the acquisition of the company from by Boston Scientific, it's with a bigger support with Boston, I think it's just gonna take off in 2024.
Yeah. It's fun things to look forward to. One of the other things that I thought was really interesting about 2023, kind of staying with the idea of radio frequency ablation, is, I think that there is a while that, maybe call it maybe a good 5 or 6 years, where there wasn't a lot of new literature being published on, at least a lot of things that made it, I think very well known, that was being published on radio frequency ablation of not new and novel places, right? I mean, everyone paid attention when, somebody published a paper on radio frequency ablation of for the hip, or when the knee studies first came out, or obviously for the basivertebral nerves. But when we're thinking about, medial branches, and whether that's lumbar or cervical, or thoracic even. I mean, I think the number of studies that I remember coming across this year and paying attention to, and things that seemed like they were very impactful studies, was beyond what I remembered for quite some time. I mean, I would probably even argue beyond what I remember outside of fellowship, which is now 8 years ago. And so I think it's a pretty interesting thing, right? Because it's a procedure that's been around for a long time. It's been accepted as the standard of care for a long time. In the past few years, Medicare has doubled down on the standard of careness of it by not allowing intraarticular facet procedures to be a thing without contraindications. And so now we're having kind of, I think, even more studies being published and looking at ways of maybe even further optimizing it, is probably the best way
Mhm.
of thinking about it. Had some articles based on lesion size, some articles looking at, the degenerative, fatty degeneration after neurotomy, and even a couple of
Mhm.
articles looking at the way that listhesis is changed over time, with radio frequency ablation, which I think are some of the questions that a lot of people have had, and we're now getting a lot more data, good data that's being published on it, which I think is pretty cool.
Yeah, it's especially for some of our older patients that uh, have other comorbidities that make any sort of bigger procedure uh, slightly riskier. Having a tool like radio frequency ablation is, I mean, it's life changing for some people. It's true. I'm sure you've seen it too. It just it, I've seen, in rare cases, people have been able to kind of go back and doing gardening when they were basically bedbound.
Yeah.
Not the case for everybody, but for something that's so minimally invasive and safe, it's a great thing. And I'm glad to see that we're kind of going back and looking into the old indications for it and seeing how efficacious they are.
Yeah. Yeah. No, I think that's been a nice trend, that I've noticed. And maybe, I think maybe one of the more frustrating things to kind of end our wrap up of 2023 before we kind of look forward. Um, I think I know our practice has been talking about this quite a bit, but there's a significant problem with the opiate shortages right now, right? Obviously the opiate crisis has been ongoing for quite some time, and that's been a real thing that's affected a lot of people and affected the way that a lot of us think about medicine. I know, for better or worse, a lot of people who do what we do don't actually do opiate prescribing, despite the fact that, in my belief, we're the ones that are trained to understand it, to know it, and know the ins and outs, and the regulations for it, and how to keep patients safe. But a lot of people don't do opiate prescribing. But now, for the patients that are appropriate, that are on relatively low doses, that are well controlled and actually getting significant improvements in quality of life, now there's this problem of production. or actually getting the medications from pharmacies, maybe to pharmacies and then from the pharmacies.
Hmm.
And I know that in our practice, that's been a big conversation point for what feels like a few months now. And I don't know if you had some further thoughts that
Yeah.
about kind of probably if we all were honest about it, probably the biggest thing that's affected the world of pain medicine as 2023 was coming to an end.
Yeah, it's just frustration all around. I think, when someone's on the same has been on the medication for a long time and they expect to go into their pharmacy that they go to all the time and see the same pharmacist they see all the time, all of a sudden being told we don't have it, we don't know when we're getting it, and we can't tell you what else are the alternatives. And then it comes back, to us, getting a phone call from a patient, on a Friday afternoon, and it's that's always when it happens, right? And
Always.
it's I wish I tell patients I wish I knew when they would come back in supply and what places would have it, but it is a challenge, and just switching medications, basically not on a whim, but being forced to switch them to
Yeah.
an alternative is definitely challenging. And, side effects come up, and so I'm hoping that this year is going to be where we can stabilize that a little bit, so that we don't have to put our patients through this merry-go-round of calling the pharmacy and the pain clinic to figure out what's going on.
Yeah, yeah. I mean, I know that our team has spent an inordinate amount of hours communicating between patients and pharmacies and trying to help people get it figured out. For better or worse, I've had to kind of memorize this spiel to be able to tell patients about, right? Like, unfortunately, we've been kind of decreasing production quotas for years. It's actually been 7 years that it's been ongoing. It kind of really came to a head. It seems like probably at some point in 2023, where there was all these decreases in the production quotas, and I think the story goes that there was about an additional 5% reduction that was enforced into 2023, with another one enforced in 2024. And that's, you mix that kind of production quotas with supply chain problems and everything else that all came with COVID. I think that's really affected a lot of people. Just to for everybody who's listening to kind of understand how trouble, at least it is here. Hopefully it's not this bad in other places, but I have a gentleman who has a relatively acute compression fracture in his back. He's in a brace, and he's not quite at the point that he wants to do a vertebroplasty. But he was taking 2 Norco a day, and he couldn't even get his Norco. We just, and the pharmacies that he was going to, they had nothing available for him. And so we're in the process of trying to transition this guy to a Butrans patch, because at least it's something that is
Mhm.
there and can be stable. But like, it's a compression fracture, right? I mean, in theory, in the next couple of months, he should be improving from that portion of things.
Right.
And so it's not really the patient that in theory is the most ideal for Butrans. I mean, I don't think it's the wrong choice for him. I think it's absolutely reasonable, but I think in the grand scheme of things, most people would presume like
Stick,
a short acting, at
right. Stick with the
relatively
short acting.
short doses, it would be something that would be easier to kind of wean down and when appropriate, right? And so those
Right.
are those are problems that we're facing to be able to to do what's best for our patients in terms of being able to take care for them. And so that's a challenge that I think we're all going through and trying to figure out.
Mhm. And I think preceding this, just thinking back before the medication shortages, I mean, it's just been, I mean, Rite Aid closing, especially in our area. I mean, a
Mhm.
lot of them have closed, and these patients are now having to basically scramble to go find another pharmacy. And a lot of pharmacies have quotas for how many chronic opioid patients that they'll take.
Yep.
So then it's even more challenging. People are driving further and further away from their house. So I'll stay optimistic and say hopefully 2024 this kind of settles out. We reach a new norm,
Yeah.
so that we don't have to put our patients through all this again.
Yeah. Well, and looking forward like that and kind of staying optimistic for 2024. What are some of the things that you're looking forward to this year? whether it be, new papers that you're anticipating, or maybe FDA approvals of things, or even
Mhm.
conferences that you're looking forward to? What's 2024 bringing you?
Well, NANS is coming up in a few weeks, so I'm definitely looking forward to that. Catching up with old friends and colleagues and co-fellows and attending, so that should be fun. And ho hopefully hearing some new announcements about new devices. I know Medtronic's been talking about their new IPG for some time. I think we talked about that a while back, and just kind of still hung up in the FDA approval process. So that I think I'm most looking forward to that. Just having the ability for some of the closed loop DTM capabilities that the new IPG is going to be able to offer.
Yeah.
Other than that, as you remembered earlier in 2023, the sacroiliac joint guidelines drastically changed through Medicare. As you recall now, for Medicare patients, if they never had one before and we think it's sacroiliac joint dysfunction, there needs to be a diagnostic block. And if that's successful and the patient has greater than 75% relief, then can we do a therapeutic steroid injection? And then, the sacroiliac joint RFA is no longer covered. So I think in 2024, there's a whole, I'd be looking forward to seeing what the sacroiliac joint posterior fusion space settles into.
Mhm.
I mean, there's so many companies out there offering this therapy, compared to the lateral fusion approach, which has been around for many years. But now with the posterior approach, just trying to see, is this something that's going to be viable? Is it going to be efficacious? It's going to be safe, and really seeing who's going to really take the lead with that.
Yeah. Yeah. No, I think that's a good corollary, good thing to be thinking about. I mean, that's definitely a space that, there's, yeah, a big turf war that I'm sure is taking place, or is soon taking place between,
Mm-hmm.
spine surgeons. I think probably more so ortho spine surgeons, but I know some neurosurgeons that really uh, like the sacroiliac fusion procedures as well. And but realistically, I mean, this is generally speaking, at least from the early studies, a much safer approach to being able
Mm-hmm.
to fuse the joint, especially if we're getting some good fusion that a lot of the studies have indicated that we are. And so, yeah, I think that'll be interesting to see. One of the things I'm really looking forward to is trying to see some of the extended data from some of the peripheral nerve stim companies that have been out. There's been a couple of some short-term data, both for um, things like Sprint, as well as the Reactivate system.
Mm-hmm.
And Reactivate is supposed to be getting MRI compatibility at some point in the not too distant future. And with some of the data that should be coming out with regarding that, I think it'd be really interesting. I mean, I like the peripheral nerve stimulation space, and I think that there is a lot of ways to be able to do some of those minimally invasive procedures to be able to help patients. And so trying to see how some of that larger data starts to look, and larger and longer term, I think will be really interesting to watch. And I'm anticipating there being quite a bit of that published over the next, probably some presented at NANS, and then hopefully
Mm-hmm.
published in the middle part of this year. Um, what else? You got any other conferences or things like that you're looking forward to?
Conferences, I think that's the only one I have planned right now. PSPS, I think, is usually in September, and
Yeah.
I'm not sure where it is this year. I don't think it's going to be in Las Vegas. I think maybe Southern California.
It was Hawaii
So
last
definitely,
year.
yeah.
And I was recently talking to some of the folks from PSPS, and I think their thought was that they want to do Hawaii again this year. I think logistically, that was
Wow.
challenging. As I've thrown conferences, not in our space, but in a different space.
Mhm.
I know the challenge of trying to coordinate everything, particularly when you're going to an island, it becomes hard. And so, yeah, I don't know that they've actually announced it, but I know
Yeah.
that their leadership is wanting it to be in Hawaii again. So maybe I'm breaking news that I'm not supposed to be breaking, but I think the choice is between Hawaii and San Diego. But
Okay.
I think that would be a fun one to go to. I mean, there's a lot of good people
Mhm.
there. And from what I heard, the last couple of years, the conference was really well attended and some really good information shared. So, yeah, I think that's probably one that I'm looking at. I know, if like I said, I've talked to a few of the folks that are towards the leadership side there. So I think that would be a fun one, particularly if they go back to Hawaii. Then we can both work on our tans and our surfing.
Yeah. Other than that, I think no other conferences. I think it's just going to be, you know, trying to get more facile with some of the procedures that I'm doing. With Intercept, spinal cord stim, peripheral nerve stim, and just trying to get it so that I'm more efficient and uh, maybe some expansion of my horizons onto sacroiliac joint procedures. But time will tell with that.
Nice. I mean, I think there's a lot to look forward to. Like you said earlier, a lot to be optimistic about for 2024. Hopefully this is going to be a year where we can continue pushing things forward, continue getting some really great data to support, the things that we have, or help to guide us as we're treating our patients, into the future. And definitely trying to remain optimistic and hopeful that for those of us that do have to deal with the opiate shortage crises, that makes itself at least a little bit easier for all of us and for all of our patients.
Agreed.
All right, my friend. Any closing thoughts before we sign us out for our entry into 2024?
I think no closing thoughts. I think just for the listeners out there, just I'm fairly new to the podcast, and I think this year we're going to be trialing some different template for our talks. So look forward to that. If there's any comments, please let us know. But we'll be trying a few different things and seeing if it maybe flows better.
Yeah, no, definitely. Everybody out there, please feel free to reach out to us and let us know. Give us some feedback on how you're liking as we try out some of these different formats and try out different ways of being able to kind of hopefully educate and entertain and all the rest. But we really do appreciate your guys' time. Thanks for listening to the Spine Nerd podcast, and we'll see you next week.
See ya.